Across the world, over 40% of COVID-19 survivors have had lingering after effects of the illness. Based on their review of 40 earlier studies from 17 countries, researchers from the University of Michigan estimate that patients' experiences with so-called long COVID, which is defined as new or persistent symptoms at 4 or more weeks after infection, the prevalence rises to 57% amongst survivors who had required hospitalization. Now, the rate was 49% among female survivors and 37% among males. The estimated long COVID rate was 49% in Asia, 44% in Europe, and 30% in North America. Among the most common problems, fatigue was estimated to affect 23%, while shortness of breath, joint pain, and memory problems each affected 13%. Now, the study likely did not capture all cases of long COVID. The researchers have estimated that 100 million people have or had long COVID since the start of the pandemic. New studies have also suggested that nearly everyone who had a mild case of COVID-19 may, a year later, still have antibodies to the coronavirus, but those might not be enough to protect them from new variants. A research team at the University of Adelaide in Australia has posted a new study which is yet to be peer-reviewed. It says that among 43 Australians who dealt with mild COVID-19 early in the pandemic, 90% still had antibodies 12 months later, but only 51.2% had antibodies that showed neutralizing activity against the original version of the virus, and only 16.2% had neutralizing antibodies against the now dominant and highly transmissible Delta variant. The study's results make the case for tailoring vaccine boosters to the variants that are currently circulating, just like how the annual flu vaccines take into account current influenza strains.
WION, now available in your country. Download the app now. Get all the news on the move.